Peace be to you all. Assalamu alaikum. This is Omar Abdul Malik, physician assistant and health educator. I want to talk to you all tonight about tests, specifically standardized exams, and the role they play in our lives as it pertains to academia and your forward progression in your careers. Now, there's a lot of controversy about standardized exams, especially here in Washington, D.C., where I'm from. Some people have suggested that the tests are biased, that they've gone as far as to say the tests are racist or classist, if you will. But there's no avoiding standardized exams. This has become a very big factor in our lives. And these are some of the exams that I've taken. I've taken this is the SSAT. This is the secondary scholastic aptitude test to get into private schools. I did that way back in high school, more than 30 years ago. Then I took the PSAT. That's the practice scholastic aptitude test. The SAT, the scholastic aptitude test. My wife and I've got 4 children, 3 of whom are teens. So they're taking these exams now, or studying to take them. I took the GREs after college. I took the MCATs. The GREs, the graduate record exam that you usually take to get into graduate school. MCATs, medical college aptitude test to get into medical school. I took the NCLEX. I was a nursing student some 27 years ago. Actually, I didn't take it. I was preparing for it. I was in nursing, a nursing program. I took this is the certification for personal training exam. I took that. Once I finished PA school, I took the PANCE. That's the Physician Assistant National Certification Exam. I've been a PA for almost 20 years now, so I've had to take the PANRE. That's the Physician Assistant National Recertification Exam. I earned my doctorate in health education, and then I wanted to become a certified health educator. So I took the certification for the health education specialist exam. Then I drive, so I had to take my driver's exam. So I've taken a lot of exams throughout my life, and they will continue. As long as I live and as long as I'm working. Why do we have to take these exams? Now, the standardized exams are really a subjective tool to determine academic level, acceptance into programs, certifications, your eligibility for licensure, and it determines your minimal competency within your chosen field. Now, I say subjective again. As the start of this video, I said that there's a lot of controversy about the standardized exams, especially here in DC. A lot of parents are opting to take their children out of the standardized exams. They don't want them to be subjected to the stress, and I think a lot of the suggested elitism of people that do well on them. But it is what it is. The exams really are not going anywhere. Some colleges are opting to no longer require the SATs or the ACTs for their students. That's kind of a version of the SAT, but I don't think most colleges are going to do that. Now, as far as standardized exams go, not everybody does as well as they would like on them. Not everybody passes them. So for your PANCE, I did not pass my path. Well, let me start from my SATs. I didn't do as well as I wanted to on my SATs when I first took them a good 30 years ago. So I took them again, and then took them again until I got a score that I felt was sufficient to get into the colleges that I wanted to get into. Same thing for my MCATs, and the same thing for my GREs. I actually did fairly well on the GREs. Once I finished, I wound up going to PA school, physician assistant school. When I took those, I did not pass the first time, and I was so upset, and I was embarrassed. I avoided contact with my my program director, um, and I was like, I just missed it. I studied so hard, but didn't pass it. So I took it again, and thank God, alhamdulillah, I passed. Here I have a bunch of test prep books. This is the pants. I've got 1, 2, 3, 4, 5, 6 different test books. I'm missing a Dwayne Williams pants pearls book, but it's a lot. These are books I borrowed from my children, the PSAT and the SAT. They're taking Kaplan. And I've got some USMLE books. I keep these because I like the way the information is done in the first aid book. And then I've got Harrison's Internal Medicine Board. I was going to get that. I got that from a thrift store. I just like reading through it. But I like studying. I don't like the necessarily the exam taking. But I'm going to talk about that. For people who don't pass their exam the first time, there was some PA students, or one very well-known PA student that did not pass her PANCE exam the first time, and she was very chagrined about it. But you got to go back and reassess, why did you fail the exam? And I had to do this. It's part of life. It may be lack of preparation. That's usually the obvious. But you got to look at quantity versus quality. So people will tell me, yeah, I studied a lot, or I studied really hard. But the quality, how many hours a day did you spend studying? How many days did you spend studying? How many weeks? Was it real effective time? I had a bad habit. When I would sit down to study, I would kind of doze off and just zone out or space out. I'd fall asleep. Some of you all know about the itis. So I learned that, your brain is greedy for glucose. So I go, let me go eat a hamburger or a big pizza or something, fill my body up with pizza, and then compensate for falling asleep when the itis sets in. Some of you all know about the itis. And try to drink a bunch of Mountain Dew or some caffeinated beverage. It doesn't work, because you spend half the time, you say, well, I sat there for 6 hours studying. Well, you were sleeping and dozing off for half of that time, and staring off into space for the other part. How much of your time was actually spent really getting good quality study time? You may benefit from a structured program. There's a lot of them. There's Kaplan. This worked for me. It may not work for you. Everybody's different. When I took the MCATs, I tried to do individualized study. It was terrible. I met with disastrous results. I got a book. I said, man, I'm not paying a bunch of money. I'm going to study by myself. Didn't work. I took Kaplan and did very well. Now, I don't work for Kaplan. They don't pay me any money at all. But it just worked for me. There's Kumon Academy, Princeton Review, Khan Academy, CME for Life for those of you guys that are taking the PANCE. This is structured program versus self-study. Only you can determine what works best for you. Time management is very important. I got to take my board recertification exams in 2022. I'm doing a little bit of studying every week now because I don't know if I'll have time while I'm working. Be wary of test changes. The SATs changed a bunch of times since I took it 30 years ago. It went up to a 2400 on the SAT. Now it's back to a 1600. There's changes on the PANCE exam. So you need to be aware of those changes. Test taking anxiety. I'm going to do another video on test taking anxiety. This was a big one for me. Freaking out on a scale of 1 to 10. From 1, you don't really, the test doesn't really bother you. It's no big deal. To 10, you're absolutely freaking out. You're going into respiratory alkalosis. Somebody's got to give you a bag because you're hyperventilating. You may need to positive talk yourself into passing the exam. Hypnotherapy. If you've got a real diagnosable condition, maybe see a psychologist or a psychiatrist for that. Medications like your SSRIs, selective serotonin reuptake inhibitors, your benzodiazepines, those may actually be of benefit to you. If you've got something like dyslexia or you're in the autism spectrum, there's a TV show called The Good Doctor This doctor is he's a young doctor. He's on the autism spectrum, but he's brilliant. I don't know if he has any problems taking exams though. But that may be you. So you've got to get, you need to see a professional clinician for that. But I hope that this was helpful for you. I'm going to do some more videos, inshallah, in the future, God willing. Okay, so please subscribe to my channel. You can reach me on LinkedIn, Facebook, Twitter, and of course YouTube. I look forward to reading your comments in the comment section. Take care. Peace.